Hi there. My name is Nurse V, and I'll be beginning this appointment for you. Today we do have a lot to go over as we are doing an all-inclusive exam. So you just sit back and relax, and all of the doctors will eventually be making their way here to you. You won't have to switch offices, but do just make sure that you get yourself nice and comfortable, okay? Perfect. So I will be doing your intake questions real fast. Would you mind just giving me your first and last name to confirm? Okay. Perfect. And could I get your date of birth, please? Okay. Thank you. And have you been feeling sick any time in the past 2 weeks? Have you had any cough symptoms or sneezing or runny nose? Any sort of rash or anything like that? Okay. Perfect. And are you taking any medications right now that we should be aware of? Okay. Thank you. Perfect. I am just going to take a quick vital check here. So if you wouldn't mind just staying still, I am going to take my 2 fingers here and just grab your pulse. So just stay still for me for just a second. I'm just gonna get that. Okay. Perfect, thank you. I'll just take note of that. Okay, and do you have any particular symptoms that you're coming here to tell us about and for us to check out, or is this just a regular checkup exam for you? Okay, wonderful. And when was the last time that you came to a doctor's office? Perfect. And how are you feeling today? You can answer however you'd like. You can tell me everything or just how your day is going. We just like to, see the general temperament of our patients. And is there anything that you'd like to talk about? This is a safe space. Of course, you don't have to say anything if there's nothing you wish to speak about, but I just wanted to let you know that if there was something that you wanted to talk to someone about, that we are here for you as well, okay? Okay. Perfect. Wonderful. Well, I will be performing your hearing exam and ear exam, so I am going to put on my gloves. Are you experiencing any hearing loss or pain or discomfort inside of your ears? Anything abnormal? Okay, and are you experiencing any sort of vertigo or balance issues? Okay. And have you been to a loud area recently, like a concert or a construction site? Okay. Perfect. And the age-old question, do you use Q-tips in your ears? Okay. Perfect. Thank you very much. So I am just going to examine your ears. I'm going to take my otoscope here. And I am just going to give your ears a look, okay? So I'm going to go this side first. I am just going to just look in your ears here. Okay. Okay. Perfect. And this side. Let's see. Be just a little bit of clogging on this side as well. Does this give you any discomfort or pain? Okay. Good. And again, what about this side here? Does this give you any sort of discomfort or pain? Okay. Perfect. Thank you. So I am going to clean your ears out just a little bit because you do seem to have just a little buildup of wax in there. So I'm going to put in just a little peroxide solution on each side and then just scrape out with a tool the excess, and hopefully that should help you feel a little bit better about your ears. So I'm just going to take my solution here and I will just have you tip your head to this side here, just tip it over there, and I will get the solution going, okay? Just a little bit of this into your ear here. Okay, and I'm just going to swish that around just a little bit. Okay, good. Just get that nice and in there. Perfect. Okay, and I'm going to go ahead and scrape out the inside of your ear. Well, not scrape, it's going to be a very gentle cleaning. Don't worry, you should not feel any discomfort, okay? So let me just take this tool here and I'll just start. There we go. You should start feeling things get a little bit clearer for your hearing here. Good. Perfect. Okay. And we'll do the other side. The peroxide will just dissipate on its own, so don't worry about needing to like clear it out or anything of that sort. So I'll go back in with the peroxide on this side, and I will just there we go. And again, I'll just swish that around just a little bit. And once again, I will just go ahead and get all the stuff that shouldn't be in there out, and you should start feeling things and hearing things a little more clearly, okay? So I'll just go in again here and scrape out all of the little bits that don't need to be in there. The excess wax. Okay. Good. Perfect. Okay. Are your ears feeling just a little bit better? Good. So let's test them just a little bit, okay? So I do want you to close your eyes for these next few tests so that you can't cheat and see what I'm trying to do. Okay, so just go ahead and close your eyes for me. Close your eyes. Okay, so first, which ear do you hear the word in? Sandwich. Sandwich. Which ear did you hear the word in? Good. And what was the word? Perfect. Okay, and now? Pickle. 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 Can you tell me what word I said? Good. And what ear did you hear that in? Perfect. Okay, let's see. How about tidy, tidy, tidy? And which ear did you hear that in? Good. And do you remember, or did you hear what word? Good job. Okay, that was tidy, tidy, like tidying up. We'll do a couple more. How about wrinkle, wrinkle, wrinkle? What ear did you hear me speak into? Good. And what word was that? Wrinkle. Good. Wrinkle. And how about coconut, coconut, coconut? Which ear did you hear that in? Good. And what word was it? Coconut. Good. Coconut. All right. So now we're just going to use strictly hand sounds, okay? And we're going to go a little faster. So just tell me which ear you think you hear the sound coming from, okay? Good. Okay. So good. 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 Okay. 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 Good. 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 Good job. Very good job. Okay. And now go ahead and keep your eyes closed for me. We have one more sound test to do. I'm going to take this little ball of like saran wrap, okay? And we're going to do a distance test, okay? So I want you to tell me if the sound that you hear is close to you or further away, okay? So this will be bass. Now, is the sound close to you or farther away? Close. Good job. And now? Good. And now? Good. And now? Good. And now? Good. And what about now? Good. And what about now? Okay. And now? Good job. You may open your eyes. Good. And how do your ears feel now? Perfect. Well, that is the end of your little hearing exam. I will be departing and another doctor will be coming in to perform the next part of the exam, okay? All right, so just hang tight. Hi there. My name is Dr. V. Yes, Nurse V is related to me, so I understand how you might be a little bit confused. It's nice to see you again. I will be performing your eye check and your skin check, okay? So we do need to get started if that's okay. How are you doing today? Wonderful. So I am just going to start by giving your skin a quick once over. So if you wouldn't mind just looking at me, or honestly just looking anywhere, and I'm just going to inspect your skin and just make sure that everything looks normal. Are you experiencing any sort of dryness? Any irritation? Okay, good. Okay, could you close this eyelid for me? I'm just going to... Okay, and this one? Good. Okay, and I'm just going to pull your eyelid down right here. I'm just going to look at the skin here. Okay, and this one. Okay, and I'm just going to look at your chin here. Okay. Perfect, and your forehead. Okay, and are you experiencing any tenderness? Any sort of uncomfortable feelings up in your hairline? Let me just go ahead. I'm just gonna check up here. Okay. Okay. I don't see anything that looks too alarming or abnormal, so I'm just going to press on your skin a little bit just to check elasticity. Okay. And up here. Good. And have you been experiencing any sort of like bumps or itching? Okay. Perfect. Okay, so I'm just going to feel down here your lymph nodes. Okay. And have you been experiencing any sort of nasal congestion? Okay, I am just going to gently press onto your nasal passages right here. Okay, and I'm just going to drag that away because we are looking like we're just having a little bit of inflammation right here. Okay, and would you mind giving me your hands? Go ahead and just give me this one right here. Okay. Everything looks fine on the skin on your hands. Perfect. And could you give me this one? Good. Your fingers. Okay. Do you have any moles or freckles that you'd like me to take a look at? Okay, let's just see here. That one looks totally fine. And down here on your neck. Absolutely normal. No worries there, okay? Let me just take a quick look at this spot right here. Okay. Yeah, that's totally fine. And this spot right up here. Okay. Absolutely normal. Your skin is looking totally fine, so I don't see any areas where I might need to give you some sort of cream or steroid or anything like that. So you're looking just fine. Were there any other concerns that you had? Wonderful. Then we will move on. So we are going to provide just a little bit of a sensation test. So I will have you go ahead and close your eyes for me. Go ahead and close your eyes. And I'm just going to poke you very gently on the face with either a hard object or a soft object, okay? So I just want you to tell me if you think you've been touched by a hard or soft object, okay? So let's go ahead and start. So, hard or soft? Okay, and now? Hard or soft? Okay, and hard or soft? Okay, and hard or soft? Good, and hard or soft? Good, and hard or soft? Good. Hard or soft? Okay, and hard or soft? Good, and hard or soft? Okay, and hard or soft? Good, and hard or soft? Good, okay. Now, same game, just a little bit different. I'm going to draw a line down one side of your face, and once again, just tell me if you think it was hard or soft, okay? So beginning now. Hard or soft? Okay. And hard or soft? Okay. And hard or soft? Okay. And lastly, hard hard or soft? Perfect. Very good job. Well, it is time to do your eye exam now. So I am just going to start by checking your pupil function. You are more than welcome to look at my nose or look behind me, but you do not have to look at the light, okay? So I'm just going to shine this light at your eyes. Good. And I'm just seeing how your pupils react to the light, okay? Good. Perfect. Okay. Good job. Again, you don't have to look at the light. Just look behind me or at me. Good job. Okay. Good job. Okay. Okay. Good. Okay. And I am just going to get a closer look at your eyes. So once again, don't mind the light here. Don't worry about looking into it. Just look behind me or at me. But don't worry about looking at the light. So I'm just going to shine this right here. Actually, let me use a dimmer light for this so that it's not quite so strong in your eyes. Okay, so I'm just going to look into your eyes here. Could you look up for me? Okay. Could you look over here for me? Just on that side. Good, yeah, just keep looking over here. Okay. And could you look up one more time for me? Good. Okay, and look down. Good job. Okay. And could you please just stare straight ahead? I'm once again just going to pull down your eyelid just a little bit. And take a look inside your eye there. Okay. Okay, and the other one. Just going to pull it down a little bit and look inside your eye there. Okay, and again, I'm just going to pull your eyelid up. Just a little. Okay. Perfect. And the other one. I'm just going to pull your eyelid up there just a little bit. I'm just going to look in there. Okay, very good. Your eyes look just fine. Okay, and now we're just going to do kind of a rapid fire test. So could you look up, look down, look left? Good. Look right? Good. Just follow the directions of my words and do not follow the directions of what my finger is doing, okay? So look up, look down, look left, look right, look up, look down, look left, look up, look down, look up, look down, look left, look right, look left, look right. Good job. Very good job. Okay, so could you just do me a favor and look at my finger? Good, and just follow it with your eyes. Try not to move your head, okay? Just keep your head still. I just want you to move with your eyes here, okay? Just follow my finger with your eyes. Good job. Okay. Keep following my finger. Good. Watch it as it moves closer and further away, closer, further away. Look over here, look over here, good. Look over here, okay, look over here, and look over here, good. I'm going to try and distract you just a little bit with the light, so go ahead and look over here. Look over here where my fingers are, good. Just keep watching my fingers. Just keep watching my fingers. Good. Good job. Good job. Good. Good job. Good job. And look over here, and back here, and up here, and over here. Very good. Okay, so I'm going to pinpoint a location. Okay, I'd like you to look right here. and I'm going to try and distract you, and I just want you to keep looking right where I'm making this circle, okay? Right here. Just keep your focus right there, okay? I'm going to try and distract you, and you just keep looking at that spot, okay? Just keep looking at that spot. Good job. Okay. Good. Are you still looking right there? Perfect. Let's do one more right here. Go ahead and look right here for me. Okay? And I'm going to try and distract you one more time. Good. Good. Good job. Good job. Perfect. Okay. So I am just going to take a few little measurements here. And let's see. Should go right about here. Okay. So I'm going to put this right here. Can you tell me? Can you see the color on this card? Can you see the color on this card? Okay, what color is it? Okay, it's green. Good job. Now we're going to get this real nice and close to your eye right here. And I want you to tell me, can you see the shape? What is this shape? Good. And can you tell me the color? Good job. Okay. And let's see. I'll put this closer just a little bit and see if that affects anything else. Good. So, can you see the color here? Can you see the color? What color is it? Blue. Good job. And what is the shape? What is the shape right here? Good job. That is a triangle. So, can you see the black line at all? Okay, now I'll adjust just a little bit here. Okay, now can you see the black line? Okay, and if I pull it away, okay. Which side of the line is the light on right now, left or right? Good, and which side is the light on now, left or right? Good job. So I am just going to kind of mess up your vision just a little bit. I'm going to put this in front of your eyes, okay? Can you tell me how many fingers I'm holding up? Okay, and what about now? Okay, and what about now? And what about now? Okay, what about now? And what about here? Can you see my fingers here? Good, and what about here? Can you see my fingers here? Good, and how many fingers am I holding up? Okay, and now? Okay, and what about now? Okay, and what about now? Okay. Good job. Very good job. You're doing such a good job so far. Alright, now I'm going to put this little contraption over your eyes. Okay, and so now I'm just going to kind of close off specific parts of your vision, okay? Now, can you see the light here? Okay, just follow the light with your eye. Good. Good job. And can you see the light over here? Good. And what shape is it making? Okay, perfect. That is a circle. Good job. Okay, and I'm going to bring the light in and tell me when you can't see it anymore. Okay? And again. Okay. And again. Okay, and one more time. When can you not see the light anymore? Good job. Okay. I'm going to change the perspective. Can you see me? Okay, and can you see me clearly? Okay. Okay, I'm going to cover up your vision just a little bit more like this. Now I'd like for you to tell me when my finger becomes blurry. Okay. And again. Here? Okay. And again. Okay, good job. And now we're gonna do the opposite. Just let me know when my finger becomes when my finger comes into focus. Here. Okay. 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 And lastly, I'm going to change. Actually, I think there'll be one more test after this, so this isn't quite lastly. So we're going to cover up this part of your vision. Now, I just want you to follow my finger again. Good. Just follow my finger one more time. Good. Okay. And can you still see this shape? Good. What color is the shape? Perfect. And can you still see this shape? Good. And what color is the shape? Good. And what is the shape? What is it? Good job. Okay. Now, I'm going to take this. Just okay. Good job. Perfect. And lastly, for real this time, I'm going to, oops, it's a little bit too much. I'll cover up that side, okay. So I'm going to take out my light again. Can you see the light? Good. Okay, so follow the light. Good job. And follow it as it goes down. Good. Just catch it when it comes back into your view. Good job. Just follow the light for me. Good. And again, follow the light. Good. And what shape did it just make? What shape? Good job. Okay. Very good job. Alright, I'm just going to put this over your vision here, over your eyes. Now, what has changed about your vision? Okay, and is this light the warmer toned light? Or is this light the warmer toned light? Can you tell? This light here? This light here? Or this light here? Which one is warmer? Good, okay. So this is the cooler toned light? Perfect, very good job. I'm just going to take out this chart real fast. And could you just read to me this line? Read this line to me right here. What's this letter? Good, E. And what about this one? This one. Okay, and this one. This one. And this one. Good, and this one. Good, okay. And now, can you read, let's see, this letter right here? Good, okay. And what about this one? Okay, and what about this one? Alright. And are you able to read any of the letters down here? Let's try this one. Okay, and this one? Okay, and what about the first? Okay. Perfect. I'm just going to write down a couple of things before I forget. That was perfect. Okay. Well, perfect. Your eyes are looking absolutely fantastic. I did not find anything that I need to look into further. Do you feel the same way? Was anything uncomfortable or painful at any point in time? Okay, lovely. Well, I will pass you on to the next doctor then. Bye. Hi there. My name is Dr. Vani, and I will be taking care of you for the rest of your cranial nerve exams. I know we did eyes and ears already, so I'm not going to worry about that. We just need to do some taste and smell little tests here, okay? So I have a couple samples that I will just be putting on your tongue, and I would just like for you to guess what flavors they'll be, okay? Perfect. Okay, so just get this one nice, ready. Okay, there we go. Perfect. Okay, so go ahead and just stick out your tongue. And good. Okay, what flavor do you think that is? It can just be a general guess. It doesn't have to be ultra specific. In the citrus family. Good. Orange. Perfect. That is exactly right. That was orange. Okay, so this will be our next sample. And let me just get that out for you. Just to get the excess off there. Okay. Once again, just stick out your tongue. And drop. Okay, perfect. What flavor do you think that is? Right, it is a little more savory. Absolutely, yeah. So that flavor is mushroom. It's got that little umami flavor, right? Perfect. Okay, and then let's see, I think we've got a couple more. I'm gonna use this one now. Get that nice and ready for you. Perfect. Okay, and again, stick out your tongue. I'll just drop that right in there. Perfect. Okay, go ahead and taste. What does that taste like? Reminds you of the morning. Very good. It's a little bitter. Yeah, that's coffee. Perfect job. Hard to mistake coffee flavor, but you never know. Okay, and then one more. Just get that one ready for you. This one has little flavor beads in it just to make sure you get that flavor that you need to. And there you go. What does that taste like? Oh yes, this one is very sweet. You are very correct. Yeah, reminds you of the summer. It's very fruity. Watermelon. Very good job. I know, it's kind of that artificial watermelon flavor, not like the actual watermelon flavor, but you get the gist, right? Perfect. Okay, and now we just do a couple of scents, okay? So I'm just gonna go ahead and put this under your nose, and you give it a big sniff. Good, yeah, just a big sniff there. Good, and what do you think that smells like? Yeah, it's very refreshing. It reminds me of a spa. Good, kind of that minty smell, right? Yes, it's eucalyptus. Good job. Okay, so now this is a little different. Go ahead and just inhale. I will allow the scent to kind of waft through the bag. Good. What does that smell like to you? Exactly. That is exactly right. So this smells like limes, right? Limes specifically, which is weird considering they are kind of a hard, solid smell, but it is that key lime scent that we're going for. So that was an astute guess. Okay. And lastly, this little guy. Go ahead and take a sniff whenever you're ready. Good. And what does that smell like to you? Yeah, like a dessert, right? Yes, that is chocolate. You guessed correctly. That is just like a chocolate cupcake in a little tube there. So you're doing very, very well. I think those are all of the things I need to have you test out. So I am just going to ask you some final questions and write them down. Did you experience any sort of flashbacks, or did any of the scents or flavors bring you to a specific memory? Okay. Gotcha. Perfect. All right, and you were not allergic to any of the scents or flavors that we assigned to you today, right? Perfect. Okay, wonderful. Well, I was the last person that you're going to see today, so on behalf of the staff here, I just wanted to say thank you for coming in. And if you had any further questions, just go ahead and talk to me or any of the other doctors at their callback numbers or their emails. We're always available for any sort of questions or follow-ups, okay? Perfect. Well, the receptionist is right down there, and you can make another appointment, or we'll just see you next time. Okay? Thanks for stopping by. Bye-bye.